Thank you very much, Jan. It's a pleasure to be here. And as you said, we've become quite fascinated with the gut-kidney axis. And so that's really the focus of my talk today is talking about this intersection between the two. Here are the typical slides that you've seen before for presentations, but these are my views and not Purina's in terms of thinking about this particular topic. I do also have a couple of speaker disclosures in terms of who we get our project support from and key opinion leader events. But what I really want to focus on today is thinking about this concept of the gut-kidney axis. And this is something you've heard some various topics today about the interaction of other parts of the body and the gut. And this absolutely applies to the kidney as well. This is a concept that's been pretty well described in human medicine and in rodent research models as well. And very much so, we're seeing that this is applicable to the feline patient. And so I'd like to share a little bit more about what we know about that at this point in time. We do know, based on our previous research, that cats with chronic kidney disease do have dysbiosis that's characterized by decreased microbial diversity and richness. And this is something that potentially worsens with iris stage. And part of this package is actually increased uremic toxins that might be being developed both as a result of decreased kidney function, but also as a result of these changes within the gut. So again, these two systems are just kind of feeding off of each other and perpetuating disease on both sides. So when we really start to think about what are uremic toxins, which might be one of the bigger sequelae of this particular interaction, we're really talking about substances that accumulate with decreased GFR. And of course, as a clinician, when we measure substances that are decreased, that increase with decreasing GFR, we usually talk about creatinine and BUN. But there's actually a large number of uremic toxins, and many of them actually do have deleterious effects. So it's appropriate for us to look at some of these other substances and the effect that they might be having in our patients. Of course, this is not something that you probably think about clinically, but there is a lot of research out there to substantiate a concern. So we'll talk a little bit more specifically about uremic toxins like indoxyl sulfate. And indoxyl sulfate is particularly of interest in the cat because it's produced in the colon as a result of protein fermentation. And unfortunately, this dysbiosis that we see associated with kidney disease does result in an overpopulation of indole producing bacteria. So again, you get this feeding, the two things are snowballing together when we're talking about both the gut and the kidney. And indoxyl sulfate is of particular concern because what we see is happening is dietary proteins are going into the gut, and in the colon, that tryptophan, which is a precursor for indoxyl sulfate, is turned into indoles by bacteria, that bacterial population that's there. Then once that's absorbed into the body, it's made into indoxyl sulfate in the liver. And unfortunately from there, it's the job of the kidney to excrete those substances. But of course, in kidney disease, we have a reduced ability to do that. And so we start to see an elevation of indoxyl sulfate. We now have good evidence from a couple of studies that have been done that indeed we do see that increase in these substances and that it does get worse with iris stage kidney disease. However, one thing that I want to point out is that even cats with relatively early, stage 2 cats, even early stage 2 cats can actually have significantly increased uremic toxins. So we often think of this as a late stage effect, but we probably don't give those stage 2 cats enough, consideration for the burden that they might be having in terms of uremic toxins. That's important because we've seen this in other studies as well, where these indoxyl sulfate concentrations are correlated with creatinine. And again, they are seen in stage 2 cats. Furthermore, there is association with progression here. So if you have higher indoxyl sulfate concentration, and this study had a relatively small number of cats and dogs, there was a correlation with progression. So we have a concern that potentially there's a biomarker here from the gut-kidney axis that would be associated with progression. And really the reason why that makes sense and is a cause for concern is we know that there are multiple deleterious effects that have been published for uremic toxins. And again, if we take indoxyl sulfate just as one particular example, p-cressyl sulfate, TMAO are other examples of substances that have been studied quite thoroughly, both on the human side and in rodent models. There's just, a vast majority of publications all tell about how deleterious these substances are. You have effects both from the standpoint of thinking about what happens directly in the kidney. So there are in vivo studies, there are in vitro studies. All of them are showing that these substances potentially are having both local and systemic effects that we potentially should be worried about. So each one of these categories, I've literally seen multiple studies substantiating that there's a part in this process. And things that we don't even think about, like the effect of uremic toxins on red blood cell health, what it does to EPO production, what it does to bone quality, how it affects muscle atrophy. All of those things that you're actually seeing in the patient in front of you potentially are being driven by these accumulating uremic toxins. And so for this reason, it really becomes quite logical that we would consider them to be a target in terms of interventions. And then the human medicine side, there are a number of different ways that we can address this. And some of these things we have approached at this point in time in veterinary medicine and also in feline kidney disease specifically. So I do want to take a little bit of time to think about, what our approach could be. What do we do about this? If we can't fix kidney function, can we palliate the situation in some way? And there really is a translational need to think about this further because unfortunately, uremic toxins are poorly cleared by conventional dialysis, and therefore they're a problem for all species. So this is probably why a lot of this research has been driven in the first place, is because of this translational potential of this gut-kidney axis and the concern for the buildup of these toxins. So let's first talk about dietary modification. And this really, when we go back, is thinking about, why it is that we think about designing a kidney diet for the patient the way we do in the first place, and the concept of what's an appropriate protein level for the patient with chronic kidney disease. In cats, that's a much harder question just because of their amino acid needs and their protein needs, and being that obligate carnivore. So when we start to look at the research, we have to ask, well, in humans, we have higher indoxyl sulfate concentrations if you eat a high protein diet. And how does that pan out in cats? Well, one study in normal cats looking at different protein concentrations did actually demonstrate that the results were not quite how we would have expected. So indoxyl sulfate was not significantly different after those cats ate a high protein diet, but there was a little bit of an uptrend in p-cressyl sulfate. And I guess I would say that it's very possible that the normal healthy patient can compensate for these mechanisms and may not potentially have as much of a problem as the cat with early or late stage chronic kidney disease. We have a little bit more data coming from early stage cats where IRIS stage 1 cats were fed diets differing in protein. And this range of protein was more along the range of those found throughout the spectrum of renal diets we have available to us. So anywhere from 5 to 8 grams per 100 kcals. And here we did see a correlation between those indoxyl sulfate and p-cressyl concentrations and the higher protein content. So there's a little bit of a correlation there, but we don't really truthfully have a lot of data to advise the situation on late stage cats at this point in time. So that is definitely a need in terms of trying to determine where should this appropriate protein balance be. And the thing is it's not just all about uremic toxins. There are other things at play here as well that might be affected by protein concentrations or the amount of fiber in the diet. So another big issue would be thinking about fecal fatty acid concentration and short chain fatty acids. Short chain fatty acids can be broken down into both straight chain fatty acids and branch chain fatty acids. And there's a big difference there when I'm thinking about the context of chronic kidney disease. Straight chain fatty acids are thought to be more beneficial in terms of coming from fiber fermentation and having beneficial properties, whereas branch chain fatty acids, again, are coming from that protein fermentation, things like isovaleric acid, isobutyric acid, and they're thought to actually have deleterious effects like promoting inflammation and having a negative effect on motility. So we'll start to talk about motility at the end of the talk here, most appropriately, but this balance between fiber and promoting motility and protein and a possible decreased effect on motility. So certain things to think about. And this is also something that we've assessed in cats with chronic kidney disease. So trying to better understand where they would be at here. And, it's hard to, especially in the chronic kidney disease patient that's eating a variety of things, sometimes it's really hard to pinpoint what their diet is versus what their concentrations are. But we've kind of done our best to take a look at this. So short chain fatty acids and branched chain fatty acids in disease, we would like to say that though, again, those straight chain fatty acids, that they are the beneficial part. We did not actually see that they were increased in cats in our particular study. So we also didn't see that they were decreased. So, and that's a little different than what we see as a result of diet on the human side. However, we did see an increase in branched chain fatty acids in feline chronic kidney disease. And again, those are the ones that come from protein fermentation. And in fact, when you look at the data, we do have a significant difference in isovaleric acid, like I mentioned. And this honestly is kind of typical cat data. So we've always got one cat that's not following the rules. And when we have an outlier like this, it's of course always really important to go back and look to see, well, what was going on with this specific cat? That cat, as it turns out, was actually on a raw diet, which was not something that we really thought about the significance of going into the study and thinking about who would be included in this analysis. So potentially that diet would be our only reasonable explanation for why isovaleric acid was so extremely high in this particular patient. And when we removed that patient, we still did have an increase in isovaleric acid in those chronic kidney disease cats in comparison to the healthy cats. So there is a concern that those branched chain fatty acids are also a target. But the problem is, again, that when I'm talking about these things coming from protein, we have a desire to both palliate the production of uremic toxins and branched chain fatty acids. But then we also have this concern about maintaining muscle mass in these patients. So the cat, again, is quite specific in that regard for their nutritional needs. And we need to say, what research do we need to figure out where the best balance is here? And it becomes quite tricky when we start thinking about their nutritional intake as well. So we know, of course, that appetite is a problem in kidney disease. We know they lose weight in kidney disease, and we know that they lose muscle in kidney disease. And some of these things are related to eating poorly. Some of these things are related to cachexia, etc. We have good evidence, though, that we're not supporting muscle mass, particularly as their stage of kidney disease increases. And one of the things that's a concern as well when we start looking at the relationship between what is actually in the gut versus what is in the cat is looking at amino acid profiles. Of course, we have concerns about that protein content. Are we supporting that muscle? Are we supporting the amino acid in the cat once it makes it to the kidney side as opposed to the gut side of the patient? And so when we look at amino acid profiles in cats with chronic kidney disease, we do see some significant decreases in amino acids in chronic kidney disease. This has been shown in canine patients as well. And interestingly, tryptophan in particular. So tryptophan is that precursor to indoxyl sulfate, yet somehow we're not actually getting that amino acid appropriately into the feline patient that has chronic kidney disease. So there's a bit of a disconnect between what's going on in the gut, these toxins that are being formulated, and the substances that we actually need to be absorbed into the cat for adequate nutrition and to support their muscle mass. And interestingly, when you look at this from the standpoint of human chronic kidney disease patients, we know that there is dysregulation or protein malassimilation in chronic kidney disease. So this particular study showed the absorption of leucine. So these patients, either hemodialysis patients or normal patients, were given a load of leucine, which is a very important amino acid for supporting muscle health. And basically, those hemodialysis patients cannot absorb amino acids as well as the normal patient. And so this is part of building this concept that we have protein malassimilation, particularly amino acid malassimilation, and this inability, for whatever reason, for that chronic kidney disease patient to be able to absorb the nutrients that we need. Now, pathophysiologically, it's not very well understood why this is occurring, but it is definitely a big concern. And this is something that, looking at my feline patient clinically, I have a major concern that this is going on based on all of these pieces that we're putting together. So this concept of protein malassimilation, they're ingesting protein, we're trying to get them to eat as much as possible, but we know the elderly cat potentially cannot absorb protein as well as they should, and potentially this is even worse in chronic kidney disease. Those proteins then are putrefying in the intestine, particularly in the colon, and they're resulting in increased uremic toxins. But at the same time, somehow we're having muscle loss and amino acid deficiency that's occurring. So the nutrients are just not making it to where they need to go. And unfortunately, the sequela is the buildup of those uremic toxins. And the bottom line is that feeding more total protein might not actually solve this problem. So we hear a little controversies about cats with kidney disease and what is the appropriate amount of protein for their diet. And I don't really think that it's as simple as feed more protein. It may be much more complicated than that. And some of that evidence comes from this particular study where potentially thinking about specific amino acid supplementation might be a better way forward than just feeding more protein in general. And another big take home from this particular study, honestly, was that the cat needs to eat well. So in this study, we saw that one of the diets the cats did not eat well, and those cats did lose lean body mass. And so that's a really important part of this. We can't actually have a conversation about how much protein you're taking in and what you're malassimilating. It's very hard to have that conversation if you're still not making your caloric intake. So our goal nutritionally for these patients is very much still to consider how to get the nutrition into them best so that they're eating their caloric intake. And then we have to have that conversation about, well, how much protein are we talking about? And again, this concept of boosting essential amino acids, boosting different types of amino acids specifically, as opposed to overall total protein, there is some evidence that that is a better strategy in general. So again, when we talk about targeting uremic toxins, dietary modification, that's what we currently know. There's more studies out there that I'm seeing every day. I'm very excited about that. So every time I give this talk, we're getting new information. Fiber modification is another way forward, and I'm not going to talk about that too much in this particular session because we've had some other conversations about that. And also for cats, we're still very much learning. I think the bottom line is that the fiber source very much matters, and we're going to need to learn a lot more about that and which ones would most specifically benefit cats with chronic kidney disease in order to really inform our therapeutic recommendations for them. So I'm going to move on to talk about prebiotics and probiotics and intestinal absorbance in terms of strategies for targeting uremic toxins. And one of the things that's been out there for a while in terms of a possible strategy is thinking about the concept of actually modulating the microbiome in a way to support renal health. So one product is thought to potentially improve that microbiome in such a way that uremic toxins would be decreased, but we haven't actually seen data for those particular supplement type products. There are a lot of products out there. This one in particular, we know that we can't sprinkle it on the food, but we don't have any data on the uremic toxins. So it's possible that this helps, but again, I just don't have the evidence to say that it does or not. Another substance that is currently available and has been available in some form in human medicine for some time are absorbents, so types of carbon essentially. So AST-120, cremizin, porous-1, this category of absorbents, and one now particularly is on the market that is a tiny little black carbon spheres. And basically the idea is that those precursors to the uremic toxins would be taken up within these pores and would prevent them from being absorbed into the body. And there's also an electrical charge that facilitates that binding. So this is something that has been studied in normal, healthy geriatric cats. And in this particular situation, they did see a decrease in indoxyl sulfate. Again, thinking about that particular substance dropping significantly in the treatment group. And there are a couple of studies that are currently underway with this product in chronic kidney disease. One's happening in Germany and a couple here are happening in the US that we've been working with. So there are options, there are strategies out there that are actually quite intriguing from the standpoint of addressing uremic toxins. However, there are other options as well when we think about just this physiologic picture. So the other big thing that I want to bring up is actually thinking about what happens in the colon. And one of the major things that happens in the colon in the chronic kidney disease patient is constipation. So this is something that if we're talking about, looking at this picture, this is the site where uremic toxins are actually being produced and potentially being absorbed up into the body. This is the site where that protein putrefaction is actually happening, and that might be the result. So for me, this is an active area of study, and really thinking about the concept of, well, can we prove that this actually results in increased uremic toxins, and how can we get things moving with the potential outcome of actually improving that scenario? So I don't think it's a mystery to anyone that we know that cats with chronic kidney disease are at increased risk for constipation. That's always been a clinical reality for us, but we do now have a retrospective study demonstrating that, at least in the emergency setting, cats with chronic kidney disease are more likely to present for that constipation. However, I don't care just about the emergency setting. I also care about subclinically just how frequently that cat is defecating and whether they're having regular bowel movements like the young, healthy, normal cat. So we've recently done some studies looking at defecation frequency in normal cats and chronic kidney disease cats. And we had a survey study that was done by the caregiver where we asked them, because a lot of people don't actually know what's going on in the litter box, we actually asked them to scoop the box daily and fill out a survey every day about what they found. And then they had to reflect upon what they learned. Was it what they expected? Was it not? And so we had groups of normal cats, enroll in the study, and we had groups of chronic kidney disease cats. So we tried to substantiate their health status as much as possible with the information that was given by the caregiver. And what we found in this particular survey study was that typically the caregivers reported that normal cats defecated about 1 to 2 times per day, and chronic kidney disease cats typically defecated every other day to daily. So there were days that were missed where no defecation would occur in the chronic kidney disease cats. And of course, this is survey study information. So it is a little bit difficult to say that this is, subjective in nature. We don't know if there was bias, if we're getting the true story from the caregiver, but most people are very motivated to do these types of studies and hopefully are giving us the most objective answer that they can. However, we have now continued this research looking at actual litter box monitors to be able to tell exactly what was happening in the litter box, even if the caregiver was not present. And these litter box monitors are able to differentiate urination from defecation. So this is a study that we just finished off this past summer with as part of the summer student research project. And interestingly, in this study, we also saw that there were regularly days missed for the chronic kidney disease cats where they were not defecating. And there was a significant difference in that in comparison to healthy cats. So we do worry that there is subclinical constipation or decreased GI motility for these patients. And very much that does then make me wonder about, again, that uremic toxin load. So that's going to be another thing that we'll be looking at, is whether there's a correlation between uremic toxins and defecation frequency. So the other thing that potentially we want to think about, again, of course, is how constipation occurs and how we could address that. And again, this is cyclic. So in kidney disease, of course, it's related to water balance. These cats are also subclinically dehydrated, and they're compensating by pulling water out of the colon. It's exacerbated by hypokalemia. It's potentially exacerbated by phosphate binders. And if I haven't mentioned this previously, those uremic toxins may also have a negative effect on colonic motility, as well as the branch chain fatty acids. So again, you get this cyclic gut kidney axis, syndrome going on that's exacerbating the situation. And on the human side, this is also the case. So this particular study looked at the uremic toxin p-cresyl sulfate, and they found that in patients with chronic kidney disease that had poorer or more constipated quality stool, that they did have higher concentrations of p-cresyl sulfate. And that there are other more in vitro studies that indicate that those branch chain fatty acids, again, can cause relaxation of colonic smooth muscle. So again, you have the tie between the two, indicating to us that really we do need to be worried about that colonic motility. We need to be worried about the effects of these uremic toxins on GI motility, because you're just going to get that cyclic effect. And that may then have a negative feedback a deleterious feedback, if you will, on the kidneys in terms of kidney health. So we very much feel that constipation is a very important target in chronic kidney disease. It's definitely something that I look for when I'm assessing my patient. I'm assessing the stool quality, both from what the caregiver tells me and then also what I actually feel myself on physical exam within the colon. We very much want to address hydration and hypokalemia, and also very importantly in the elderly patient, we want to think about OA and whether they have discomfort during defecation that might prevent them from posturing appropriately and be able to have a good bowel movement. Fiber may again be a place that can help some of these patients out, but that has to be, part and parcel to hydration. You do need that hydration. That dehydrated cat may not be very effective with that fiber. That's also true with osmotic stool softeners, of course, because what they do is they pull water from the rest of the body into the colon in order to hydrate that feces and soften them. And if you have not addressed overall hydration, we may become, that may result in an even more overly dehydrated patient. And then last but not least, we may also reach for those pro-motility agents in these cats to make sure that we're getting that gut moving as much as possible. So in closing, I think it's really important to think about the concept of this interplay between CKD and the gut. It's really important because it's not something I think we've routinely thought about. And the more we learn about it, the more we discover there are abnormalities present that have been below the surface that we probably have not appreciated. And there are ways forward. There are other ways that we can address kidney disease other than, I guess, the typical historical treatments that might be thinking really about the health of the microbiome, thinking about how we prevent these various substances from accumulating in kidney disease, and again, slowing down the cyclical process where we have a negative effect on both the gut and the kidney. So that's what I have for you today, and be happy to take any questions.